We've been working with health systems globally. We've got deployments in about 20 countries. We help health systems achieve a lot of their digital health strategies, as well as their interoperability goals. What I'm going to be talking about today is kind of a broad topic, building smart digital healthcare delivery models. And the best way to wake everyone up, right after lunch is to basically talk about a very, very interesting topic: quantum mechanics. Right? So this was one of, I actually attended a talk, a little over a year ago in the UK, where the CCIO of the NHS England, actually made this really interesting correlation. Quantum mechanics or quantum physics, it's actually the study, obviously of subatomic particles and how they interact with each other. I'll give you a quick physics lesson right here. In essence, everything that we see around in our world, right? All the different laws of physics, of gravity, of electromagnetism, everything is basically derived by what is called a basic interaction, right? The basic interaction is basically how the most minute subatomic particles talk to each other and how they work with each other. Now, what quantum physics basically talks about is that if you actually make subtle changes to the way that these basic interactions happen, it actually can have a butterfly effect on the more macro observations that we can say, right? So things like, gravity, or, the basic laws of physics can actually be altered if those basic interactions are changed. What was really amazing was that during this conversation, he actually talked about how this applies to healthcare. In healthcare, obviously as health systems, we all have a lot of goals and objectives, right? So we have goals and objectives for quality, we have goals around patient satisfaction, we have goals around financials, but everything boils down to what we call the basic interaction. The basic interaction is the interaction between a patient and their provider, right? Those are the two subatomic particles that exist in the healthcare world. And what our argument is, that if you actually start making meaningful changes to this very simple basic interaction between a provider and the patient, you can literally create magic in terms of all the overall overarching goals and objectives that a health system and providers basically have today. And what's really interesting in this zone is, and I'm a big comic book fan, so a little bit on the geeky side. If you are aware of a lot of comic book backgrounds, Superman actually has a lot of his superpowers because subatomic particles in his body, basically the basic interaction is altered, which gives him all of these powers. And during these conversations, we actually realized was that when we develop and when we deploy strategies to interact with patients, if you keep this basic engagement in mind, and if you keep that as the focal point for all of your decision making, the impact on all of the other metrics that health systems have today can actually be magnified. Now, what we've typically seen is, as health systems across the world, everyone today is looking at adopting digital health strategies. The way that consumers behave, the way that consumers have actually interacted with all kinds of services in the marketplace has changed, right? You no longer are hailing a cab, you're using an app to book an Uber or an Ola. You're getting your groceries delivered at home. A lot of the services would have required you to be on the phone for like 30 minutes. Today can actually be done self-service. And what's really happening now is that health systems across the world are realizing that, and they're trying to figure out how do we actually start building the strategy to start transforming the experience that a patient has, the experience that a provider has, and collectively make this, make this synergistic so that you actually see great results. Now, across all of the tens of implementations that we've had globally, we've actually figured out that there's been a common thread, right, in terms of how we've seen those implementations get successful, how we've seen providers implement digital strategies with great success. And we've actually broken that down into 4 points. 4 points around how do you actually strategize, how do you execute those strategies, and I'm going to try and basically succinctly explain those in the next 8 minutes that I have. The first thing which we've realized is that, when we talk about changing patient experiences and adopting new consumer models with them, the focus has to be on what the provider and the patient's experience is. Everyone around the entire ecosystem can be impacted if you actually make informed and really insightful decisions on how that basic interaction works. So the first thing we actually tell health systems is focus on that basic interaction. If a patient is coming to your hospital today or is walking into a clinic and is getting services, the 5, 10, 15 minutes that they actually see a provider or the other staff that they actually meet before they see a provider, the experience and the interaction that they have is of utmost importance. In a digital world, we're not only talking about those 5 or 10 minutes anymore. We're talking about a much more longer term engagement, right? So today, if I want to basically go to a hospital, I'm booking an appointment, I'm basically, I'm touching base with a lot of different people before I even see a provider. So focusing on that basic interaction is extremely important. To be able to do that, we really need to understand what those different touch points are. So when we talk about digital strategy, we talk about, all right, how many different touch points does a consumer or a patient really have with a health system? It can start as early as somebody booking an appointment. It can then lead on to what their experience is when they walk in to the premises of the health provider. Their experience can be impacted. There's another touch point where they're filling up forms, they're filling up a lot of data before they get to see a provider. Then there's another touch point where the provider is actually meeting with them, right? And after that visit is over, there's a whole long journey after that. The patient walks out, he's probably got some medications, there's some diagnostics that they need to basically get done. There are a lot of different touch points and a lot of different service providers within the hospital that end up basically interacting with them. And what's really interesting is that in the digital world, those touch points are now extending to outside the four walls of that hospital as well. So if it's a patient who's diabetic, he came in, he had a visit, he was able to book an appointment, but once he actually left the health system, there has to be a constant engagement with that patient as well, so that they actually create more touch points around how they're interacting with their healthcare providers. So what we typically look at doing is, we look at prioritizing those touch points, right? As part of a digital strategy, you can't do everything all at once. So start prioritizing, look at what are the biggest problems that you want to actually solve. Do you want to actually look at solving the interaction that a patient has with the appointments? Do you want to solve it for after they leave the hospital? We work with health systems to basically understand how do you prioritize that. The third thing, which actually, to be very honest, we've learned this the hard way, is upfront, set measurable goals and objectives. This is something which everyone knows, and when you're embarking on large implementations, it's obviously something that needs to be thought of. What typically happens with a lot of newer technologies and digital health applications, because you're now dealing with consumers, right? And you're dealing with consumers that might have a variety of different kinds of opinions and different kinds of ways of interacting with services. It's very difficult to basically, be subjective and say that I'm going to set up some core measures and goals and objectives for this entire project. As an example, if a health system is, say, coming out with a mobility, a web and a mobile way of actually engaging with patients, changing that per visit interaction to a more longitudinal relationship, they might have multiple goals and measures that they want to really capture. Within appointment booking, they might want to look at, hey, can I actually start reducing the amount of time a patient spends on the phone? Can I actually start reducing the amount of time our call center executives actually spend servicing every patient? Can I actually reduce average wait times for patients? Can I actually increase the number of patients that keep on coming back to the health system after they've actually left? So those are multiple measures and goals and objectives that need to be set right at the beginning of the strategy for any of these digital health experiences to actually be successful. The fourth thing, which I think has been the most important, and I come from a tech startup world, and one of the things that we learned many years ago was to basically ship fast, right? Get to market fast, get your product in front of consumers fast, be able to deploy quickly, learn from what the consumers are saying directly by how they're using your product, and then basically iterate and repeat till you meet those goals and objectives. And I think this is a very, very different approach than what is traditionally done in healthcare, right? And a lot of industries. When you're actually talking about digital applications that are going out to consumers, being able to be agile, being able to learn immediately from those, from different points of data, from different feedbacks that you're getting from patients is extremely important. And what's even more important is to iterate. Don't be afraid of basically coming up with something new, changing stuff, and repeat till you actually meet those goals and measures. And what we've typically seen is that if you start focusing on all of these 4 points in that order, you actually can end up creating something which is not just another app that a health system or a provider puts out in the marketplace.